Hello, everyone. Thank you for taking the time to join the session today. Our guest speaker for today is Dr. Manoj Agny. A very warm welcome to you, Doctor.
Thank you.
Thank you for taking out the time to join the session. And could you please share your journey with our young doctors?
Okay. Well, at the very outset, let me apologize for the delay. But let's get started, okay? So my name is Dr. Manoj Agny. I'm a senior consultant cardiac and transplant surgeon. And I joined medicine in 1980. So about 42 years back, like I said in the introductory video clip. And then subsequently, I finished my basic graduation in 1985 from Government Medical College in Aurangabad. Then did my master's in surgery. So feel free at any point to note down your questions because my journey might possibly, make you curious about something that you would want to ask. So 3 years of general surgery masters, which is called MS in general surgery. And then I came to Mumbai and I did my master's in cardiovascular and thoracic surgery. In India, it's called as CVTS, cardiovascular and thoracic surgery. And in the United States, it's just called as MD in thoracic surgery. In UK, it is FRCS, Fellow of the Royal College of Thoracic Surgeons. So I finished in 91, worked for a couple of years with a senior cardiac surgeon, because that's something that I will come to as we go along, that it's not like any other surgical specialty where you finish your training and you could be into practice the next day. Unfortunately, the way it works in India is that you need to spend a couple of years working in an institute as a junior surgeon or be affiliated with some senior cardiac surgeon. And then typically I would say almost 98% of us, after we finish our MCH, by the time you're 30, 31 years old, you go abroad for a couple of years. Now, in my times, there wasn't even a center for giving the licensing examinations to the United States, which were called as ECFMG, then FMGEMS, then USMLE. Anyway, so I went to Singapore, cleared both the steps, which involved a lot of subjects right from first MBBS days onwards. And then 96, I landed up in the United States and was there initially in a place called Portland, Oregon, just north of California and south of Seattle. We did very actively adult pediatric cardiac surgeries and heart transplantation and lung transplantation. Then I went to England because though I was on a visiting scholar, a professor's visa called J1 visa, you run into the typical visa issues after 4 years. And I also wanted to make my training in transplantation more complete. So I went to England for a couple of years at Within Hospital in Manchester. And then I came back to Chicago for a couple of years because every time I would come to India, I was surprised to see the amount of beating heart surgery which was being done for coronary artery bypass grafting, which is very uncommon, even in the United States, Europe, Australia, where 80% or more surgeries are done on a stopped, arrested heart, but for different reasons, essentially economic ones. In India, beating heart surgery was gaining momentum. So I went to Chicago, got trained in that, mitral valve repairs, came back to India, practiced at almost all the major private hospitals in Mumbai for close to 13 years. And then went to pursue my transplant passions because my kids had grown up and I could afford to go and set up transplant units in Bangalore and Ludhiana. And now I'm back to Mumbai. So that has been my journey. I think we would be better served if you were to ask me some questions because that could be a starting point. But I was asked to enumerate, what are the essential qualities that are needed by a cardiac surgeon. So let me just tell you briefly, how does the training start here in India? As I said, after you finish your master's in general surgery, you get into a super specialty training program that you have opted to choose. It can be cardiothoracic surgery, neurosurgery, plastic surgery, pediatric surgery, and urology, and so many other things. And at our time, there used to be an entrance exam. I think it's still the case here right now. And then you do 2 or 3 years of training in cardiac surgery. Now, during this training, it is imperative that the 3 T's and the 3 C's, as I label it, get developed, which are important and essential for you to become a good cardiac surgeon. And the first 3 T's, T for tree, the first one would be technically sound. You need to get technically sound because the margin for error in cardiac surgery is 0. It's not even 1%. Most of the times, you are kind of likely to be, oscillating between life and death of the patient if you kind of mess up. So you need to be absolutely well trained for that. And for that, as I will come to later, your mentoring and training becomes of paramount importance. So the first T is technically sound. Second is teamwork. You need to be a team leader. You need to imbibe those qualities on you because this is one specialty where it is not only one person who's doing the entire work. You are the head of the team. There is an anesthesiologist there who kind of anesthetizes the patient. And then there is a perfusionist who runs the heart-lung machine. There is an associate who takes out the various conduits that are required for coronary artery bypass grafting. Or these are the ones who help you out when you do mitral valve repairs, aortic valve repairs and replacements, or complex pediatric surgeries. So there are so many people who are involved. In addition to that, you have a cardiac surgical intensivist, because all of your results are essentially going to depend not only on your skills, but also to some extent, and sometimes, very significantly, on how the other team members are going about their whole, expert jobs. So you need to be sure that you're coordinating with all of them, synchronizing with them, and ensuring that everything is being optimally carried out. So team leader, the second T. And the third is temperament. Temperament is extremely important because you are going to be tackling, sudden events, which could be, again, of very critical nature, where you suddenly have a blood pressure of, say, 40 or a heart rate of 200, or you have a sudden gush of blood through the chest tubes. So you need to be able to be, tackling those situations in a very balanced manner. And these are, at times, situations of extreme stress. So don't let me scare you, but, in your training, you kind of get used to it. So to go over the 3 T's, as I said, technically sound, secondly, being a team leader, and third is having the temperament, the right temperament. I also mentioned 3 C's. C for cat is you need to be confident, because that's how you're going to ensure that the rest of the team members are feeling good about the whole process. The patient and the relatives also feel, confident about, taking up something as huge as an open heart surgery, decision by them. And your confidence would be of paramount importance. But then that confidence obviously comes from being well trained technically and being able to deal with, whatever comes up, at any time. So confidence. Second is you need to be cool, as I said, because sometimes when things get very difficult, you need to be maintaining your, composure there, because if you panic, then, it's just panic everywhere. So one person needs to be at the head of the whole event and taking care of this, emergency. And the third is being very composed, because the more you start getting rattled, the more it's likely to affect not only the way you do your job, but the way everyone else is carrying out their responsibilities. And as I said, rattled because, there are going to be sometimes sad, but inevitable events, just because of the disease complexity, where you have done your best, but you just could not get the right desired result. Let me just recap quickly, because I was told that there was some, the voice issues in the past 2-3 minutes. You need to be technically sound, you need to be a good team leader, and thirdly, you need to be having a good temperament. Then you need to be confident, cool, and composed, because all of these things are going to be extremely important to take care of critical situations in the operating room or in the ICU, which you will encounter on quite a regular basis in cardiac surgery. Okay, so I hope I wasn't kind of muted when I said some things important about teamwork. So I think teamwork is vitally important. So that's the reason I'll recap it again. That your results and the optimal care of the patient would depend not only on your skill sets as a surgeon, but also on the way the other team members, and who are all very important people in this whole process, like the anesthesiologist, the perfusionist, your clinical associate who's taking out the conduits required for coronary artery bypass grafting, or giving you a hand while you're doing complex valve repairs and replacement or doing complex pediatric surgeries. So all of these people need to be in sync with what you have in mind. And secondly, you also need to coordinate the whole process so that everything goes in the right stepwise manner, in a smooth way, ensuring very good result. As I said, also, I don't know whether that was muted, but digital dexterity and steady hand develops over a period of time. That is important, but more important is to have imagination. Imagination in the sense you need to be able to conceptualize in your mind, hey, this is how it's going to be looking after I carry it out, before you actually do it. So like when I attach one thing from year to year, then how is it going to actually go? What is the lie of the graft going to be when I repair a valve? I need to be able to think the end result in my mind before I get started, because I think that will help you carry it out well. So now elaborating a little more on the non-technical skills. So as we said, we have the technical skills, which I've spoken to you about just now, but the non-technical skills would be in the sense that you need to understand the economic complexities of the interaction that will be there between your hospital and the government, or the hospital and the insurance companies, or the people who are referring cases to you. And it's very variable. It's different in the United States, where it's primarily insurance driven. In the United Kingdom, where it is all NHS funded, with 90-95% of the people getting operated in kind of government setups, which is called as the National Health Service, and very few going to private. Whereas in India, it's a mix. The people who can afford, most of them end up in private, and they pay through their own pockets almost 75-80% of the time. It's only 25-30% of folks in India are insured. So you need to understand this whole economic complexities, because that is going to help you have a good relationship with the people that you are either working with or at the hospital that you are associated with, because the hospital also has its own vision, its own goal, and it needs to be sure that while it is being helping in optimal patient care, it's also generating some decent amount of profits, so that it can keep on getting the hospital better with newer technologies which come up, or keeping some money aside for the indigent or the free class patients. So those are the things that you need to very well understand. Then among the non-technical skills that you need to develop is you need to be academically sound, because as you start getting older, you have the responsibility of training the next generation, because you're not going to be there forever. So you need to be sure that you're leaving a good amount, a good kind of skill sets with the next generation, which is going to succeed you. Now, I remember a long time back when I just finished my master's in 1994 in the Journal of Cardiovascular and Thoracic Surgery, Thoracic and Cardiovascular Surgery, called JTCVS. There was an article which mentioned that in addition to being very good at what you do, you also need to be developing, or rather be trained in humanistic disciplines like moral philosophy. And they even went to history, arts, and literature, because the whole thinking behind this, and I am in total agreement with that, is that a cardiac surgeon's job is not only looking at logic, but also being very rational and humane. You don't want to end up in a situation where there is, how would I put it, that you have developed a very high level of technical brilliance, but at the cost of not being able to be empathetic towards the humane aspect of the patients. So you need to be treating the patients as a whole. Okay, so that is, I think we have covered almost all the points here. Now about the United States, if you're an Indian graduate, you need to give USMLE 1 and 2 and 3. And then you go there and then you get into a residency program. It's important that you choose and pick, because they will also choose and pick you. They have a very different system to the one that we have in India, where, unfortunately for you guys now, all these centers are available in India. USMLE, you could join some Kaplan classes or something. And once you get above 75 percentile, and then according to what is in demand that moment, what are your inclinations, say you want to be a surgeon, you want to be a physician, but I'll talk of cardiac surgery. It's currently not a very difficult specialty to get in, because once the cardiologists came up with something called coronary stenting, a lot of people were taken up for stenting who would have otherwise gone for cardiac surgery. So it is not too difficult to get into cardiac surgical programs, but then you would be interviewed by the concerned hospital, and there they have a nice system where it's a matching program. They would match out of 10 people who came to be interviewed in the order that they perceived them to be fitting into their program, and you could also match the 4, 5, 10 programs that you went and interviewed. And when there was a match, like you are second with someone else's who's also matched you second, or in that order, you get into it. But remember, as young graduates, you need to be sure that you are asking them that, hey, how am I going to be 3 years from now if you finish your general surgery course? That is typically taken care of well in the United States, because they ensure that the training is complete, that by the time you actually pass out, you are in a position to take care of almost all the basic operations in cardiac surgery. If you want to super specialize, you could do some fellowships like in transplant or complex pediatric or something of that kind. But aortic valve replacement, mitral valve replacement, coronary bypass, some adult congenital surgeries, all of those you will have done in by numbers, because they have something called as a residency review committee which comes and looks out for all of that. So I think the training programs in the United States are excellent. I was initially a fellow and then subsequently a faculty teaching American thoracic cardiac surgery residents, as also the general surgery residents posted on the service. In England, there is something called as a CCST, where you need to be getting registered for that. You need to pass lab exams from here and subsequently qualify for those. And once you do that, then the training is pretty good. It's a 5-year program, but when you pass out, you are also, like the United States, pretty well equipped to do that. In India, we have some institutes which are excellent, but a lot of times, we, like I did, a lot of other people, even today, feel the need to go abroad and get trained, because it's not fully complete. In the sense, you get to watch high quality surgery, but actually surgery is being able to do it yourself. So